Tear is one of the most common knee injuries, especially in a state full of skiers. But now there's a different option to repair and preserve it.
KRDO 13's Bryn Carmen meets a doctor and a patient to learn more about a new technology in this Healthy Colorado segment.
Skiing is a way of life for Matt McCarthy. But like so many skiers, a bad fall led to a knee injury last January.
The MRI showed that it was a bucket handle meniscus tear, as well as a partial MCL and full ACL tear.
ACL tears are common athletic knee injuries affecting over 200,000 people annually in the United States, according to the American Academy of Orthopedic Surgeons. The current standard of care is a reconstruction to create a new ACL using patellar, quadriceps, or hamstring tendons. While the results work well for most patients, it's pretty invasive.
I knew that recovery time was, pretty tough. Usually a year, maybe 15 months, depending on how the PT and surgery goes. And there can be way more complications.
McCarthy hurt his knee during a ski trip in Jackson Hole, but he's from South Denver, and his dad found Dr. Sean Kelly in Colorado Springs, who specialized in a new knee surgery technology.
That new collagen implant called the Bear will allow your body to actually form a clot within the knee so that you can heal the ACL. It will repair itself without actually needing a new graft of tissue.
Here's a video of how it works. It's a bridge-enhanced ACL restoration using a special collagen scaffold to help the injured ligament heal. Designed initially in Boston, it's been researched extensively over the past 10 years and was approved by the FDA for patients over the age of 14 in 2020, and it's been growing in popularity ever since.
This looks more promising and potentially less arthritis over time for the replacement. And we had seen his brother, like you mentioned, had gone through the traditional and taken the hamstring, and it took him about a year and a half for rehab. And the rehab stats were really what was most impressive when we considered this.
Patrick, Matt's dad, was hopeful this would be a faster recovery, and it is.
I still will tell patients that getting back to twisting, pivoting, cutting sports, more high energy sports, skiing, things like that it may still take 9 to 12 months to get back to that. But what we're starting to see is there are folks that are actually being ready to do those things probably a little quicker than 9 to 12 months.
6 months after surgery, Matt passed his first return to sport test and was recovered and strong.
Clearly I had a schedule because typically I expected, at least a year. But that put me right around the 9-month mark, and I was clear to ski to start the season. I have almost 30 days under my belt already and feeling awesome.
Dr. Kelly says his team has done the most Bear procedures in the entire country, with many patients coming from out of state for the surgery. And in the last few years, he's seen more patients who are good candidates for the Bear choose that procedure instead of the traditional graft. If you have poor tissue quality, it might not be the best ACL repair for you, and the standard surgery might be a better fit depending on how your knee looks after injury. In the studio, I'm Bryn Carmen, KRDO 13.